Hi, so I'm going to be administering medication, so I'm going to check my orders and I'll see that I am administering Kefsol, normal saline, heparin, vitamin B12, atenolol, and acetaminophen. And so I will make sure that the patient doesn't have any allergies against the medications. I'll make sure it's the right route, dose, actions. I'll look for any contraindications, things like that. And then I will gather all of my meds. So here is and acetaminophen. I'll gather a couple of those, heparin and vitamin B12. These. Set these on the table here. And then my IV solutions as well. So when I go into the patient's room, I'll knock on the door, I'll introduce myself. Hi, I'm Tori, I'll be your nurse, and I'm just going to be administering some medications today. I will ask for their name and date of birth, and then I will scan their armband to make sure I have the right patient. And then I will wash my hands and apply my gloves. And then I'll also ask just one more time to make sure they don't have any allergies. And then I will do medications one at a time. So I'll ask what they would like to do first, if they like an injection or oral medications first. They picked the oral. So I will scan one at a time. I'll do the atenolol. And then I'll act like I have a cup in here, and I'll place it into the cup. And then I'll do the Tylenol and acetaminophen into the cup as well. So I'll let them know that the acetaminophen, which is the yellow pill, is for the fever they have. I'll just make sure they don't take more than 4 grams per day. And then the atenolol is for their hypertension. They may experience some dizziness when they change positions. So I will hand them the cup and offer them water, and I'll make sure they take the medication. Stand by their bedside. I'm done with those. And then next, I will do the injections. So first I'll do the vitamin B12, and we're giving 1,000 micrograms, which is basically 1 milliliter. So I will begin to prepare that. First I will put the blunt tip on, take a gauze or an alcohol. Okay, and I will rub at the top. And I'll also get a different one and rub the injection site in a circular motion. Throw that away. Since we're giving 1 milliliter, I'll get that amount of air, take the, lump tip off, and I'll just inject the air in, and then I'll tip over and pull out 1 milliliter. And then scoop this back up. Make sure there's no air bubbles. And then I'll place the other tip on. So before I inject, I'll just tell them again, this is vitamin B12. It's just for your anemia, and you may experience some soreness at the injection site. So this is intramuscular. So basically I'll go 3 fingers down in the deltoid area. I will kind of pull the skin apart, take this off, pull it apart, and go at a 90-degree angle and inject and pull out, and then I'll scoop, and then I can place gauze on it if needed. And then I will get my heparin. Now this is a sub-Q injection. I'll take the blunt tip, a different blunt tip, and put it back on. And we're gonna do 1.5 milliliters of heparin. So I will again gather 1.5 milliliters of air, take the cap off, place it in, and inject. Tip over and gather about 1.5 milliliters. Gather a little bit more since there's air in there. And then I'll scoop again. I'm going to take this off actually. There we go. Place the other tip on, and then I will let the patient know that this would be an injection in the stomach area and the abdomen, and I'll pinch the skin and inject. And this is heparin, it's a blood thinner, so you may experience some bruising and some bleeding as well, so we need to watch out for bleeding especially. So what I'll do for a sub-Q is I'll take the cap off, I will pinch the skin an inch, go in about 60 degree or 90, and inject, pull out and let go, scoop it up, apply some gauze if needed as well. Oh, and I should have washed that with an alcohol wipe as well. And then last but not least, do the IV. So this is normal saline. This is just for hydration. You won't really experience any adverse effects. We'll also be giving some Kefsol. This is for the pneumonia, and you may experience some nausea, vomiting, or diarrhea. So what I'll do is I'm going to prime my normal saline first. I'm going to remove paper. I'll just hang this here for now. And then I'm going to take this cap off and take this glue on. There we go. And place it in there. Okay, and once I do that, I'm going to squeeze this a couple of times, make sure it's at least halfway or 2/3, and then, oops, I'm going to make sure that's clamped before anything. And then once that is in, I will prime it. So I'll put this over a trash can and just watch the fluid come out from the end, getting all the bubbles out, basically. Maybe. Oh, that would be why. There we go. And then I'll clamp it back up, and that one is primed. So I'll just hang it up here again. I'll do the same thing with the to the hook. So it sits lower. And I will make sure that doesn't hit the ground like it just did. And then I will hang this one up here. Make sure it's clamped. I'm gonna remove this red cap. And that cap. Place it in, and then I will squeeze that till it's about halfway. And then I will prime this one. There we go. And then once they're both primed, I will take an alcohol and we're going to be using this site here. I'm going to clean that for about 15 seconds or so. And once that's clean, I will remove this and twist it on here so they're connected. And then I will take this part here and connect it into the IV port. And before I connect it, I will look at the IV port in the arm and make sure there's no redness, swelling, any tenderness, or if it's warm to the touch. And then I will unclamp to let the fluids flow. And then once I'm done with that, I will ask if they have any further questions. I will make sure their call light's in reach. I will lower the bed to a normal height, remove my gloves. I'll wash my hands. And I'm going to document everything, make sure I scanned all the medications. I'll document the time I administered, and then I will come back in about 30 minutes to check on the patient.